all of the benefits out there, all the things people don't understand about Social Security. And this is also a live Q&A as well. Already got some questions here. Someone who's turning 70 wants to know about benefits for them and their disabled adult child and their wife. Tons of questions. So, and that's the issue that 99% of people don't know about Social Security. And if you're new to my channel, my name is Ed Weir. I ran the third business Social Security office in the country. I've processed hundreds of thousands of claims. My office has done millions of claims and over decades. And this is what I do in my semi-retirement, is help you all make sure you're getting everything you're eligible, everything you're entitled to, everything you paid into. And this is what 99% of the people out there, the 1% are the people that are regular viewers to my channel that subscribe, like, and that come here on a regular basis and help themselves and help their community. But what 99% of people don't understand about Social Security is how complicated it is. It's the old thing is if all you have is a hammer, then everything looks like a nail. So people think when they talk about Social Security, they think retirement or Social Security cards, and that's pretty much it. But there's so much more out there. There's obviously retirement. You get early retirement. You got your retirement at your full retirement age. You've got delayed retirement credits. You've got voluntary delayed retirement credits. You've got the annual earnings limit. You've got the monthly earnings limit. The DRCs, you've got spouse benefits, current spouse benefits, divorce spouse benefits, independently entitled divorce spouse benefits, disability, retirement, and disability together, Medicare, the Medicare Savings Program, the Part D prescription drug program, child benefits, auxiliary, it just goes on and on and on and on. So people only know what they know. And if you're regular viewers to my channel, you can see pretty much every day that people come in here and they say, okay, what do I do in this situation? And quite often, unfortunately, I say, actually about a year ago, 2 years ago, 6 months ago, whatever the case may be, you should have done X. But because you didn't, you possibly are going to lose some money, but here's some workarounds to see if we can get that money back for you. So that's what we're going to continue to do today. I've made over 1,300 videos explaining all of the acronyms and all the programs I've talked about, but each situation is different. That's why there's over 20,000 pages of Social Security policy, because there's so many different variables out there, and your situation might not be the same as other people's situation. So that's why I do this live Q&A. And I've also got, if you go into my web page, I answer a lot of questions on my website. So it's mygovexpert.com. And in the, also I've added this new thing in the bottom left there. You can click on the button in the bottom left of any page on the website, and there's a little camera icon there, and you press it and you can ask a video question. If you don't want to type your question in, you can ask your video question. You or someone you know, grab your phone, go to my website, press record, and have your friend, relative who needs help. I've got, let's see, I've got 4 video questions today that I want to go ahead and answer. But before we get started with that, again, so I want to go ahead and get into some live Q&As. But again, all of the different programs that just so many people are missing, it's it's going to get even worse, unfortunately. It's going to get far, far worse, because Social Security staffing is at a 50-year low. That's even before Elon Musk and Doge came in. Social Security was at a 50-year low. This was a concerted effort by politicians who are trying to kill Social Security. How you kill Social Security is you make people hate it by, you know, saying, hey, the money was stolen, the trust fund was given out to this group or that group, and, you know, the service is terrible anyway, because we made the service terrible because we didn't support Social Security. And then it's easier to go ahead and, you know, kill Social Security, give it over to their billionaire buddies on Wall Street. So on my website, I go through all of those, so you can go in there and find information on retirement, survivor, spouse benefits. I've added a bunch of sections over the last month on overpayments, living overseas, Medicaid, veterans, appeals, myths debunked, living on Social Security alone. So make sure you check out my website. I think it's 100 times easier to use than SSA.gov, but and then I also put together a bunch of calculators on the website as well, working in benefits and calculate your work, how it affects your benefits, and a bunch of calculators on there, 100% for free. So go for it. And then if that doesn't answer your question, then record a video and ask your specific question. Okay. And let's go ahead and get into it, because that's a secret, is each situation is a little bit different, and we really need to address this on an individual basis. And our live Q&A is sponsored by Chapter Medicare there. So if you need help with Medicare, reach out to them. Okay, let's go ahead and get some questions here. Let me see. I'm trying to find the one that says about the 70-year-old person. I think it looks like it disappeared. But okay, so the person was 70 years old, and the spouse, they have a disabled adult child. And the question was about that disabled adult child receiving benefits on the father's record. So the mother is already receiving benefits, and the child is entitled to benefits as a disabled adult child. A disabled adult child is someone that became disabled before the age of 22. So they became disabled before the age of 22. Therefore, they're eligible to receive benefits on the parent's record. And right now, it sounds like the mother is receiving benefits. So therefore, the disabled adult child is receiving benefits on the mother's record. And the father is going to go ahead and file for benefits later. And yes, if your benefit amount is higher, if your what's called the PIA, your primary insurance amount, which is your benefit at your full retirement age, is higher, then yes, they will be able to switch your adult child will be able to switch onto your record. But you mentioned 70 years old. And that's what's called the delayed retirement credits. So when you delay your retirement after your full retirement age, so if your full retirement age is 66 or 66 and 8 months or 67 or whatever the case may be, every month you wait, your benefit increases up until you hit 70. So let's say your full retirement age is 67 and you wait till 70, 8% times 3, 24%. So your benefits will increase by 24%. However, that is not the number they use for your disabled adult child, because those are delayed retirement credits. The only time a child can receive that, a spouse can receive that, is when you shuffle off your mortal coil as a surviving spouse. So they will determine. So if you go there and say, "Hey, my benefit amount is $5,000. Shouldn't my child receive 50% of that?" No, because that $5,000 is the only reason somebody receives $5,000 is if they have delayed retirement credits. So the max probably about $4,000. So it'll be based on that, whatever your PIA, your primary insurance amount is, but it's not based on delayed retirement credits. The only time a spouse or someone can receive delayed retirement credits on your record is when you pass away, unfortunately. So. All right, let's see what else we have here. A lot of questions about the so-called Big Beautiful Bill, and yeah, the people that were looking to pass it, they say, "Oh no, it's not cutting Medicaid. No, Medicaid is fine. We're just getting those 26-year-old people's, in your basement, playing PlayStation. We're just kicking those people off." But proof is in the pudding, right? Follow the money. Lisa Murkowski out of Alaska has, realized, oh yeah, a lot of people in her state are going to lose Medicaid and SNAP and all that kind of stuff. So she says, I'm not going to vote for it unless you exempt Alaska. The other 49 states, screw y'all. But she's going to support Alaska. And she realized, as Josh Hawley and other Republicans realized, Elon Musk realized, hey, this is going to kick a lot of people off of Medicaid, and it's also going to affect Medicare on the tail end, and it's going to affect SNAP food benefits, and these people know about it. Lisa Murkowski said, I'm not going to vote for it because it's going to hurt my people. And then they made a, typical politician, middle of the night backroom deal. Oh, okay, we'll exempt the people in your state. We'll screw everybody else in the other 49 states, but we'll exempt you. But then the Senate Parliamentarian came in and said, no, yeah, nice try. So she may not vote for it when it's coming around the next time around. So reach out to your politicians. This is going to hurt a lot of people. Even if you're not receiving Medicaid, it's going to hurt, because we're going to go back to being, the emergency rooms are going to be the primary care physicians for millions of more people. So if you, yourself, your family, loved ones have an accident and they want to go to the emergency room, expect lines, because people are going to go there rather than going to their primary care physicians and stuff like that. They're going to go to the emergency room because they don't have health insurance. And then that is if your local hospital is even still open. And that's another thing, follow the money. They realized that because of all these cuts to the Affordable Care Act, Medicaid, eventually Medicare, that there's about 900 hospitals throughout the country that are really, really going to hurt, and they just might shut down. So they realized that, and they threw a few pennies into the bill, kind of a slush fund to see if they could address that. But who's going to control that trust fund, that slush fund? So if you're in a state that the politicians don't like, then yeah, you might be out. They passed a big, beautiful bill today. No, they did not. It's the whole thing is kind of complicated. So the House passed it, and then it goes to the Senate, and the Senate took it up, but they haven't voted for it completely yet. They're still they just voted to advance it to kind of a full vote type of situation. And then once they do that, then with all the changes they made in the back room in the middle of the night, all the amendments and stuff, all the stuff they hid in there, then they send that back to the House. And then if the House approves it, then it eventually goes to the president. But long story short, we still have time. We still have time to reach out to your people and say, your politicians, and say, yeah, we know what you're doing. And yes, they throw a couple of pennies at the people, that are struggling, temporarily. They throw a few pennies at you. But the vast majority of this goes to the super rich and giant corporations. I mean, make no mistake about that. They know that. Trillions of dollars of extra debt are going to our children. So enjoy your the gold coins. Fake gold anyway. Gilded Age, Mark Twain. 65, covered with insurance from work, plan to retire in 3 months and will be out of the U.S. for 5 months. Will I be penalized for Part B and D when applying for Medicare when I turn to the United States? Okay, so you're 65 years old, so you're probably not receiving Social Security benefits right now, because if you were, then you would have already been signed up for Part A and Part B, because if you're already receiving Social Security benefits, they automatically sign you up for Part B, Part A and Part B once you turn 65. So you're not receiving benefits right now because you would already had your card. Okay. So you're waiting till later to start your benefits. No problem. So you don't have to sign up for Medicare at 65 if you currently have health insurance from work. So you currently have health insurance from work, your work or your spouse's work, and your employer has to be have 20 or more employees to be what's called creditable coverage. So if all that's good, then you don't need to sign up. And once you lose that health insurance, so let's see you lose it next month or 2 months from now, technically you have 8 months to go ahead and sign up, and you'll get no penalties whatsoever. So you have 8 months. So make sure you plan it. So you're going to be retiring in 3 months, and then you're going to be 5 months out there. So when you come back and you want to go ahead and file, once you come back from your whirlwind tour of the world, then let me get rid of this here. Okay, let me show you where the documents are. So you go into my website, you go into the Medicare there, and enrollment periods, and it tells you about the general enrollment period, but it's also, you're talking about enrollment after losing your job-based coverage. So the 8-month special enrollment period. So when you come back, you just need to provide these two forms, the CMS 40B, which I have a nice little link here, and the 564, which I also have another link there. And that basically, you have 8 months to get that completed, and you just go ahead and sign up for Medicare at that time. If you want, just to maybe play it safe, if your health insurance is going to be ending here soon, you may want to just go ahead and sign up for Part A and Part B. Even if you're going to be out of the country, in case something happens while you're out of the country, you can immediately jump on a plane and come back, and you'll have health care. But, for that 5 months, if you don't have anything, then not sure what country you're going to go to, but that's an option too. And remember, Part A and Part B are awesome, but there's 5 financial gaps that you're going to be stuck with. That's why people either get a Medicare supplement plan, the Plan N or the Plan G. Those are the ones I recommend, or a Medicare Advantage plan. But it really depends on your particular situation. You can reach out to partners there at Chapter, and they can find the best plan for you, give you all your options, and they 100% free. So, all right. Louise, keep calling your representatives about voting down Trump's big, beautiful bill. Yes, it is narrow. They are trying a reconciliation method because they can't get the 60 votes they need to overcome a filibuster. And it's going to put debt on our kids. It's going to kick millions of people off of Medicaid. It's eventually going to hurt Medicare. It's going to hurt your local hospitals. But hey, the rich are going to be able to buy another yacht. So if that's your focus, then big, beautiful bill is a beautiful thing if you're looking to buy a new yacht. If the doctor that provided original SSDI evidence retired, are new doctors notified if Social Security obtains medical records for a CDR and they can refuse to provide the records? No, they should provide the records. The doctors, if you when you do a CDR or file for disability, you sign a form called SSA 827, Authorization to Release Medical Evidence. Short little form. You just sign it, basically put your name, Social Security number, address, yada, yada, yada. SSA 827. And then the Social Security Administration uses that form and sends it to the doctor, and that authorizes that doctor to provide that medical evidence. So they should provide that medical evidence. It's your medical evidence, so... And you're telling that doctor to give your medical evidence to the Social Security Administration. So that's the issue. Let's see. What do you think will happen to banks if Social Security is not there? What will happen to banks if Social Security is not there? If they privatize Social Security, that is. If they privatize Social Security, banks are going to be very, very happy because they're going to, their investment arms will get all that, the $2.6, $2.7 trillion that's in the Social Security Trust Fund, and the $1.3 trillion that comes in through FICA taxes every year. Yeah, that's the end game. That's what they want. They want to privatize Social Security so they can take our money and head to Las Vegas and bet. And it's one of those heads I win, tails you lose type thing. If they make a good bet and they make a lot of money, they'll get tons of commissions. If they make a bad bet and lose a bunch of money, then they'll still get commissions and their fees. We'll pay for it. Kind of like the .com bubble and the real estate bubble and all the rest of it. So will I be getting a raise on my Social Security this year? If so, when? I live in Arkansas. Yeah, Social Security is a national program, so it doesn't matter where you live. COLA next year, so the COLA. The only way your Social Security benefits will increase this year is if you worked last year, and that's one of your high 35 years of earnings. So if last year was one of your high 35 years of earnings, then Social Security eventually recalculates that, throws out the low one, adds the new one, and then increases your benefits accordingly. That's 100% automatic. You don't have to do anything. So my daughter was married to her husband for 17 years. He killed himself after divorce proceedings. Wow. Is she entitled to widow's benefits? She's still working. All you had to do is be married to someone for 10 years in order to be eligible for benefits on their record, or if you were married to them for at least 9 months. But yes, she is eligible. However, because she's working, not sure how old she is, in order to get surviving spouse benefits, this is surviving divorced spouse benefits, then she has to be at least 60 years old, unless she's disabled. This is another thing I forgot to mention, another acronym, DWB, Disabled Widows Benefits. So if you're disabled, a disabled widow, between the age of 50 and 59, you can get disabled widows benefits. But if you're not disabled, then you can start surviving spouse benefits at 60, surviving divorce spouse benefits. But with any type of retirement type benefit like that, you are limited to the amount of money you can make. This year it's $23,400. So if she's making over $23,400, then they're going to hold back $1 for every $2 she goes over. If she's under that, then, tell her to go ahead and file and get that money. It's anytime you take money from Social Security, pretty much on every program, it's reduced if you start those benefits early. So if she starts at 60, it'll be reduced by about 30%. But she'll get those checks. So Taken took. Hey, what's up, Taken? Even Rand Paul recognizes that the BB bill will increase the deficit if they keep those tax cuts. Since Paul is also a physician, I hope he also recognizes how it will harm Medicare and Medicaid. Yeah, he's kind of a one-trick pony, I guess. It's kind of like me. I just, try to focus on Social Security and Medicare. He just focuses on, the budget and the deficit and the debt and stuff like that. But yes, he realizes, I'm sure he does, but whether he cares, I don't know about that part. But he cares about the deficit and debt and everything. Him and his father always cared about that. So yeah, I'm sure he recognizes how much it's gonna hurt people, even those that are not on Medicaid. And again, it's also going to come around and get people that are on Medicare as well. Part of the sequestration. My husband's brother thinks those of us of lower income just partied it up and brought this on ourselves. I can't stand the judgmentalism. Yeah, life is what happens while you're making other plans. I always say, you remember that time, 10 years ago when you were driving through that intersection and that, that the person that ran the red light or the drunk driver hit you and, and destroyed your life and you became disabled and stuff like that. And they say, no, that never happened to me. Well, that's because you went through that light 5 minutes early or 5 minutes late, and if you left the house 5 minutes early, that could have been you, because that happens every single day. And I've had people come in and file for disability. And what was your disability? I completely threw out their back, had, massive surgeries, massive pain. What happened? I was moving my end table from one part of my room to the other, and I twisted the wrong way, and that was it. Never being able to stand straight and work again. Just little things like that. And that's the problem about working in Social Security and hearing all those situations. It's like now I'm like super, super paranoid. Oh, anytime I move a table, I'm like, I remember that one lady. Yeah, she was making like $100,000 a year as an executive. And then she was just moving her end table and it just completely changed her life, or going through an intersection, or, coming down with some disease, or, yeah. So people like that. Yeah. I am divorced. If it happens to them, just like, it happens to, all these politicians, they always hate this and that. And then all of a sudden when their child has that situation, then, okay, I see the light now. Okay, they get a little bit of compassion and sympathy there, but come on. I am divorced. Can I draw on her, whatever it is called? Can't remember what it is called. I was told I could. Is it true? Okay. All right. So number one, if you're divorced, you're talking about divorce spouse benefits, and you had to be married to the person for 10 years, number one. And then you have to file for benefits on your own record. So you file for benefits on your own record. You can't do that until you're 62 for regular retirement benefits. So you file for benefits on your record at 62. And if your divorced spouse is at least 62 years old or receiving disability benefits, then you can file for benefits on that person's record. If the calculations are correct, your full benefit amount has to be less than half of their full benefit amount. So that's an important consideration. All right. I think in my some of my video questions today, someone asked that. So let's go ahead and watch some of the, I've got 4 video questions today. Let's go ahead and watch those. Once you're on disability.
Hey there. So I'll be 65 this year, but I was paralyzed 5 years ago and unable to continue working. And so I was in the process of retiring anyways from my government job. Anyways, I was denied Social Security disability benefits. I'm wondering you know, if I qualify for Social Security disability insurance benefits.
So as soon as you hit 62 years old, then you would be eligible. Once you're on disability. Okay. Wow. See what I was just talking about. Life is going beautiful, and then something happens. You get some type of infection or something like that, and you're paralyzed. So we have to, come on. You're your brother's friend or whoever is. No compassion. Anyway, that's another side story. All right. So yeah, you're paralyzed. I can see the shadow of the things up there that I guess you use to get around. It definitely, I'm not a medical doctor. I'm a doctor, but not a medical doctor. It definitely looks like you're disabled. So the only thing I can think of in your particular situation is you mentioned you're a government employee. So you probably are one of the government employees, the city, states, federal. I think you're too young for the federal one, in terms of you work for a government agency that did not participate in Social Security, did not pay into the Social Security FICA part of the FICA tax. You paid into Medicare, so you're eligible for Medicare, but you're already 65, so that's not an issue. But I'm thinking you were a government employee, and one of those 3% of government employees that the Social Security Fairness Act is addressing right now that did not pay into Social Security. Your state or city decided not to play with Social Security. So if you didn't pay into disability FICA, then unfortunately that's why they denied you, because you're just not insured. I'm thinking that's the reason. But if you did pay into Social Security, again, when you look at your pay stubs, it'll say FICA tax. But FICA tax includes Medicare, the 1.45%, and Social Security, the 6.2%. You paid, all city and state government workers pay into the 1.45%, but they don't pay into the other 6.2%. Again, 3% of the workers don't pay into that part. And if you're one of them, you're not entitled, you're not eligible, you're not insured for the disability part. If I'm wrong and you did, then, and if they denied you, then you need to file an appeal. You definitely need to file an appeal. You can do that usually within 60 days of getting your disability decision. And make sure you check out my website. I've got an entire section on appeals. File, fight it. The first section is a request for reconsideration. I've got the form down there. It's the SSA 561. The next level is the administrative law judge. The next level is the appeals council. The next level is a federal court review. So fight it if you're actually insured for those benefits. So always, 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 if you disagree with a decision by a government entity, please fight it. Okay, I've got a few more questions here.
I am currently 64 years old. I started to collect my Social Security at age 62. I was previously married for 10 years, over 10 years. Got divorced. I remarried. Is there any extra money I can collect in my Social Security besides just my Social Security? My current husband's Social Security is more than twice the value of mine. And my ex-husband, who is now deceased, Social Security is higher than his.
Okay, so yeah, a lot of people make this mistake and they think, okay, so let's say if you were married and divorced twice, So you get married to the person, have to be married 10 years to be eligible for benefits on their record if it was a divorce type situation. So you're married to someone and then you get remarried and then you get divorced again and now you're single. So people think, well, because I got remarried before the age of 60, which is not relevant to a divorced spouse benefits, only to a surviving, but because I got remarried, I can't get it from the first spouse. No, you can get it from the first spouse, second spouse, third spouse, whatever the case may be. Social Security always looks at all of them. And because I've done this millions of times, well, not millions, hundreds of thousands of times. And they look at the record where the most money is. So if the most money is on the second ex-spouse, then that's where they file. And then if later something happens to the fourth ex-spouse, they switch from a regular spouse to a surviving spouse because they're deceased now, then they switch you to that one, which again, 99% of people don't know, and they're missing benefits out there. Okay, so you can go to any spouse if you're eligible based on, the duration of marriage and everything. But because you're remarried now, it sounds like your current spouse, the only way you can get surviving spouse benefits is if you remarry after the age of 60. So normally when you're receiving surviving spouse benefits and you remarry, those surviving spouse benefits end. However, if you remarry after the age of 60, then they're not affected at all. So that was changed a few decades ago. It was called the living in sin. That's what they called it. And they say there's a bunch of seniors out there that are single, lost their spouses, receiving surviving spouse benefits. They find a new love in their life, and they want to remarry. They want to marry that person, but they don't because they're going to lose benefits, and that's not right due to seniors. So they said, all right, if you want to remarry, go for it, and we won't stop your benefits. So that was actually a compassionate thing Congress did. Go figure. All right, we got one more here, two more.
Hey, Dr. Ed. I'm trying to find out if I can draw against my ex's retirement. We were married 24, 25 years. I've been on disability for about 19 of those years. So I draw my disability. But we're divorced now. We've been divorced a year. And I'm 65. He is 66 and will turn 67 in January of 26. What I want to know is, can I file on his? He made, of course, a lot more money than I did by me being out on disability so long. I appreciate your help. I appreciate your answers that you give us, where we're not all confused. Like I'm confused. I'm staying confused. But I thank you so much. Thank you so much.
Wow. Thank you so much for that. Oh, thank you. Okay, so this is different than the previous question because there's another variable in there. So you're receiving disability benefits, and you could possibly, it sounds like your ex-spouse's benefits probably going to be higher, and that's not going to affect your disability. So if you're eligible for spouse benefits, divorce spouse benefits, surviving spouse benefits, if you get those, that doesn't stop your disability. So a lot of people make that mistake. They don't go for that extra money because they think it's going to stop their disability. And you ask, that's dumb. Why would they do that? It's extra money. Because they think if it stops their disability, it also stops their Medicare. If you're 65, it doesn't matter, your Medicare will continue, but they're afraid to lose their health insurance. So they don't go get that extra money because they think it's going to stop their health insurance, which it won't, because you're still going to get disability. You're just going to get those other benefits on top of that. One offsets the other, but if there's extra money there, you'll get that extra money on top. Okay, here's the variable. Is that you mentioned you've been divorced for a year. So if your ex-spouse is currently receiving Social Security benefits and he might be waiting to collect the full at full retirement age or 70 years old or whatever the case may be. But if he's currently receiving Social Security benefits, then you can go ahead and file and get benefits from his record. Okay. If he hasn't filed for retirement benefits yet, then you're going to have to wait a year or until he files. This is called independently entitled divorced spouse benefits. It's a mouthful. So again, my website there, you click on the family one and there it is, independent divorced. So independently divorced benefits, you had to be married to him for 10 years, which sounds good. This is if he hasn't filed yet. So a lot of people out there are walking around and they're sitting there or waiting for their ex to file. You don't have to wait for your ex to file. As long as they're at least 62, you were married to the person for 10 years. And this is the key. You have to be divorced for 2 continuous years. You're just been divorced for 1 year. So again, if he's already receiving Social Security benefits, you're good. File for benefits, get that extra money. If he hasn't filed for Social Security benefits yet, then you're going to have to wait another year until you meet that 2-year duration. And you're like, well, how do I know that? Just call Social Security and say, hey, I want to file for benefits on my ex-spouse's record, and just give him the Social Security number if you still remember it. If not, just give him the person's name, about how old they are, where they were born, and the Social Security employee can find the Social Security number, no problem. And they'll check the record, and if that person is receiving benefits, they'll say, okay, we need to set you up an appointment so you can get your money. If not, then you're going to have to wait. And unfortunately, there's so many people out there, the 99% of people don't know about this, and so they don't file for it. And the people at the front windows of Social Security often don't know about it because they don't get it that often. The people that work in the back that are called T2CSs, which before I became a manager, I was a T2CS. That means Title II of the Social Security Act, a claim specialist. We know about it, but you have to get past the front windows. And how you do that is I even provided the reference on my website. So this is the Social Security Administration reference that you can go in there, independently entitled divorced spouse. So you print that off and you take it down there. And that way, when the person at the front windows say, oh no, you can't file for benefits on his record because he needs to file for benefits first. That's true if you're currently married, but a divorce type situation, it is not true. So you just pull that paper out, you throw it on the desk, and they will have a sheepish look on their face, and they'll say, oh, just a minute. And they'll go in the back and they'll come back. Who would have thunk it? You can. All right, let's put you in the back and get you some money there. So, all right, let's see. I got some other ones here. Did we do? Okay, okay, this is the last one.
Hi, Mr. Ed. My name is Sajid Aziz from New York. I watch your program. I really enjoyed you. Really provide valuable information. I have one question. I filed for my retirement benefits and I start receiving my benefits. I'd like to know if I'm still working. Whatever money goes to 401k, does it counts against the yearly earning income? Can you kindly answer that? Thanks very much. God bless you.
All right. Thank you for the question. Yeah, very good question. That's asked quite a bit. The annual earnings limit for this year is $23,400. And people always ask, okay, what does that include? It only includes essentially gross wages from work, like on your W-2, and then, your net income from business. So that's what it includes. And then let me show you real quick on my website. I've even got a calculator. So if you go into the retirement section there, You click on the working while benefits. I've got a cool little calculator we built, calculate your impact, and it tells you how much, you expect to earn. But income that doesn't count, investment income, pensions, and all that kind of stuff, and it tells you what does count. But you are saying that, let's say you get your gross wages are $100,000. And then out of that $100,000, let's say you're putting $20,000 into a 401k. So you're saying, does the $80,000 count? Because I'm putting some, no, it does count. You can't exclude that. It has to go by the gross wages. What you do with that money after you get it from your employer, whether you put it in a 401k or IRA or pile child support or alimony or save it or, burn it in the backyard, what you do after that, Social Security doesn't care about. It's how much you actually earn. So if that money that you take out of your check still counts for Social Security. So they look at the gross wages. A lot of people miss that. But remember, there's also the monthly earnings limit as well. So when you start your Social Security benefits, Social Security doesn't care what you earned before you start your Social Security benefits the first year. It's when you actually start your Social Security benefits. It's called the monthly earnings limit. And there's so many people that are missing money, missing benefits because they don't understand the difference. So, Margaret, it's probably too late to call anyway. They're busy on the floor. I doubt it will have any effect as they're getting it done. But remember, it still has to go back to the House, still has to go to the president. And so, but yeah, it's, so if it's signed by the president and made into law, then I guess we go into our second mode of, of trying to stop the bleeding as much as possible. Because one of the things on the big beautiful bill, the one thing that is definitely going to hurt is the fact that there is because politicians, they're not playing checkers, they're playing chess. We're playing checkers, they're playing chess. And they're like, no, we're not cutting Medicaid. We're doing this, that, and the other. We're rolling back regulations and stuff. Well, one of the regulations that they're rolling back says those Medicaid employees, the people at the Department of Social Services or wherever, a Medicaid office, they're supposed to help you get the documentation and not deny you immediately if you get something wrong. They're rolling that back. And I can tell you how difficult it is to navigate the bureaucracy. That's why in my semi-retirement, I'm coming out here and doing this. So people are going to miss deadlines and they're going to be denied. They'll eventually maybe be able to get it back after a month or 2 months or 3 months of going out with prescription or, missing their doctor's appointments or whatever the case may be and stressing and dealing with it. Or a lot of people will just give up. And that's been proven to be the case. After COVID, the whole pandemic, there was a lot of people kicked off of Medicaid. 75% of those people kicked off of Medicaid were kicked off incorrectly. They should have not been kicked off. That's going to happen even more going forward because they're not there to help you. And that's, how politicians do that. They cut the funding across the board. And so there's going to be less people in those offices to help you, less money to help people in the states. And then they're going to make it more difficult to get that help. So that's how they cut, 10 million people off of 10 million people plus off of health insurance. And then everybody's going to go to the emergency. Yeah, it's not sure what we're doing here as a country, but oops, from above, 35M versus 75 via Medicaid. Is there a possible reason for this discrepancy? 35 versus 70. Oh, there's 70 million people on Social Security, but yeah, so that's probably what you're thinking of. 70 million people on Social Security. You're just looking at how many millions of people. But a lot of those people on Medicaid are children, people that are pregnant, people on seniors, people in nursing homes, disabled, all the rest of it. So that's who it's really, really going to hurt. It's the direct laws are not, hey, if you're in a nursing home, we're going to cut you off. No, politicians aren't dumb. They're not going to do that. They just cut the budget and make it more difficult. And the end result is people are going to get cut off. So yeah, we're playing checkers and they're playing chess because they're funded by, anyway. But the consolation prize is these billionaires get another yacht. Seniors will get an extra 5K single 10 carried married standard deduction under the BBB. Actually, it's but a standard deduction which won't affect, a majority of people. It's just a standard deduction. It's just an increase of the standard deduction. So it's not the no tax on Social Security that was promised. That's not in there at all. So and most people that won't even help, about half of the people on Social Security, because half of the people on Social Security don't even pay taxes on Social Security because their taxes are too low. So none of that is going to help them at all. The deduction's not going to help them all, and the no tax on Social Security wouldn't have helped them at all. So doesn't matter. So it's always. I just started collecting SSDI for the last 6 months. I have 2 bad knees. It's not enough to survive on. Am I able to work and earn any money without losing my SSDI benefits? Absolutely. It's called the work incentives there. And you can, again, go onto my website. I've got a big, long Dr. Ed's SSDI work incentives sheet, kind of a guide that will guide you through there. And I've also got a calculator that you can check out. But basically, you are allowed to work while you're on disability, Social Security disability benefits, but there are a lot of limitations. At first, for the first 9 months, there's no limitations. You can work as much as you want, earn as much as you want, because everybody wants you to go back to work. You want to go back to work, make more money, get out of the house, yada, yada, yada. The government wants you to go back to work so they don't have to pay your Social Security disability and you pay taxes. And so it's good for everybody if you go back to work. That's why Congress set up this 9-month trial work period. And it's not necessarily consecutive. So you can work for a month, go over the limit for that month to start the trial work month. It's $1,160. So the first month you go go over $1,160, that starts your trial work month. And you have 9 of those, not necessarily consecutive. If you stay under that and you never trigger a trial work month, then you can work, all you want. Well, as long as you want, not all you want, as long as you want. But don't go up to that limit. Don't go up to 1,159 because that's probably going to be a red flag. About $1,000. If you go back to work and make about $1,000 every month, then you can do that forever, and it won't affect your Social Security disability insurance. And remember, once you hit your full retirement age, you will stop receiving disability benefits. It'll just switch to regular retirement benefits. And then there's no limitations at all because you're on regular retirement. You can earn $1 billion a month and it doesn't hurt you at all. Somebody asked me, I missed one of the earlier questions about the trust fund. Is there 2 different trust funds? Is there a disability trust fund and a retirement trust fund? Yes, there is. So it's the OASI trust fund and the DI trust fund. There's 2 different trust funds. That's why in the future cuts that are going to happen in about 2033 or 2034, you're hearing different numbers. You're hearing there's going to be about 19% cuts, or you're also hearing there's going to be about 23% cuts for everybody, one of those. And I believe it's going to be the 19% cut unless we do something about it, which it doesn't look like we will. But what will happen at that time, I think those 2 trust funds will be consolidated because the Social Security Disability Trust Fund is good for a long, long time. It's got a lot of money in it. The Old Age and Survivors Insurance Trust Fund, that's the one that's really hurting. So that's why they say 23% cut. But what will happen is the Disability Trust Fund will put it into the regular. That's why it's going to be about 19% cut. So more than you wanted to know. Someone asks, can I replay this somewhere? I came late. Absolutely. I've got, I do a live Q&A. People think I do it way too much, but hey, a lot of people need help and I've got an hour to in my life every day to commit to this. So you go into my YouTube website. And the person is asking on TikTok, and they don't have a live replay on TikTok. I haven't been able to find it. But anyway, you go onto my YouTube channel, mygovexpert.com or mygovexpert. Just Google or Dr. Ed Weir, and you'll see my YouTube channel pop up. And every single live Q&A I do, you go into the website and it'll have on the tab, there's videos, and then there's a live tab. You click on the live tab and it'll have all of the live Q&As I've done, for the past year or so or more. Annette, I was told by Social Security that I could not receive my ex-husband's Social Security because we both were at full retirement pay benefits. We were married 43 years and divorced 2022, and he passed away 2023. So you're eligible for those benefits, but whether the calculations work, that sounds like what they're talking about. So you are possibly receiving more benefits. Your benefit amount is higher than you would receive off of his. So that sounds like it's the situation. So you were both at full retirement age, paid benefit. So yeah, whether you're full retirement age, that's not relevant. But if you're at the maximum and he's with the maximum, then yeah, you can't receive any because you're already maxed out. But I would, if you were told that by someone at the front windows, those are called CSRs, customer service representatives, and they are the hardest working, least paid people in Social Security. Nothing but respect for them, but they're generalists. They're not experts in the Title II or Title 16 of the Social Security. They're generalists. So if you have a question on that, if you think that they told you the right information and you actually talk to a claim specialist, then you're good. But if you have some doubt, then schedule an appointment and say, hey, I want to file on my ex-husband's record. And if they say, oh, I just looked and I did a cursory glance of your record and yada, 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 and you say, okay, well, that's great. I want an actual definitive decision letter. So once they generated the decision letter, that means they took a claim and then they adjudicated the claim, and you'll receive an official decision letter, and it'll tell you, yeah, because your benefits are higher, not eligible for any other benefits. So let's see. Ozo, I appreciate you helping people. Your monk knowledge is so deep. Thank you. I appreciate it. Yeah, and they're changing stuff on a regular basis. So that's my other hour of my day, keeping up on all the changes. And I've got spies throughout the agency that keep me abreast. Hey, Ed, they're trying this other thing. Hey, tell your people to make sure they do this before they come into the office. So yeah, I've got my tentacles out into the entire country. What about questions? My ex passed away a few years ago, but was married 11 years. Yeah, same types of situations. So you were married 11 years, so that's the 10 years. If that's your ex, that means a divorce type situation. So you had to be married to the person for 10 years, which sounds like it is, but now it's based on your benefit amount. Okay, and then for the people asking survivor benefit questions, here's a strategy for all those new people out there. My regular viewers know this. They're tired of hearing me say the same things, but anytime I look at a YouTube video, I always see that about 90% of the people watching these videos are new viewers. So that's why I repeat these. So Bella and Take and Took and Penelope and all the Pink Owl and all of my regulars, I apologize, but 90% of the people watching today are probably new viewers. Okay, so survivor benefits are different than spouse benefits, divorce spouse benefits, current spouse benefits. If you're filing for current spouse benefits, divorce spouse benefits, and that person is still out there alive and kicking, you have to file for benefits on your own record first. You file for benefits on your own record first, and then if you're eligible for benefits on the other person, then you file for a spouse claim. Okay, that's if that person is still out there alive and kicking. If not, surviving spouse benefits are completely different. You can file for surviving spouse benefits as early as 60 years old. So let's say you start at 62 and you're eligible for benefits on your own record. And you're also eligible for surviving spouse benefits. Which one do you take? Well, it really depends on your situation, how much the benefits are on yours versus surviving spouse, but you can take both. You can delay one. So you can take surviving spouse benefits on your own record, on your deceased spouse's record, take surviving spouse benefits, don't touch yours, and then collect surviving spouse benefits. And every year or so, every few years, you call up Social Security and say, hey, how much are the benefits on my record? How much have they increased to? They will continue to increase until you hit 70 years old. So some people, they receive surviving spouse benefits, and then at 70, they switch to benefits on their own record and get a whole bunch more money. Or they take benefits on their own record at 62 and then don't touch the surviving spouse benefits. The surviving spouse benefits, most of the time, they will continue to increase until you hit full retirement age. But the calculations are a little bit wonky, so you definitely need to call and find out whether they're going to increase after the age of 62 and a half. Sometimes they don't. Really depends on strange situation. But anyway, so if you decide to do that, depends on how much the benefit is. You can file for benefits on your own record. Don't touch your surviving spouse benefits. And then once you hit your full retirement age, then switch to surviving spouse benefits. And those are two strategies that way too many people miss, because one of the things the Social Security Administration, they're trying to push everybody to the internet, and there's the old hammer and nail thing that Social Security is retirement, and I guess I have to go online to file for retirement, and you go in there and file for retirement, and then 2 years later you come here and you say, what did I do? Why didn't I file for surviving spouse benefits first, or do this and delay that? And so share, like, subscribe, all that kind of good stuff. So that way this information goes out and more people get what they're eligible for. Agreed. It is our country, regardless of conservative, liberal, or anything else. Yes, 100%. I showed a picture of Arlington National Cemetery, where veterans are buried, and on none of those gravestones does it have liberal or conservative or Democrat or Republican. It has, American. So when the politicians like to divide us, they like for us to call each other all these nasty names, and they laugh all the way to the bank, which they're pretty much doing right now. So, and the reason they're able to do that is because we can't come together, because we just start calling each other names, and they love it. What is a parliamentarian? I didn't know we even had one. Do they have to listen to her? Yes. They have always listened to her, and she's been in the office for a long time. Parliamentarian, Robert's Rule of Parliamentary Law. Yes. I was a debater in high school. Yes. I went to Baylor University during the summer, so I can tell you I have no life. I had no life I was also a troublemaker in high school, too. And I was on the debate team, captain of the debate team, but also a troublemaker. But anyway, yes, it's a parliamentarian. A parliamentarian has to go by the rules of the Parliament, but of Congress, and saying, hey, here's the rules that y'all decided, and I am the referee, and these are the rules y'all decided. And last year, or 10 years ago, or 20 years ago, or 30 years ago, or our founding fathers, or whatever the case may be, and I am the referee to decide. So when you say you're going to pass a reconciliation bill, it has to strictly be about the budget. You can't sneak stuff in there about, policy type stuff that's not necessarily budget related. Yeah. You can't, Taco Tuesday, oh, okay, from now on, Taco Tuesday for everybody. You can't, that's a policy thing that has nothing to do with a budget. So Lisa Murkowski and all those tried to sneak stuff in there, and the parliamentarian says, no, you can't do that. So they either have to take it out completely, or they figure out some other sneaky way, backroom way to add what they want in there based on their corporate overlords. So, is there a program for dental? I get Part A and B. Unfortunately, no. There definitely should be. There is dental if you're like in a massive car accident or something like that, and you need, you know, facial reconstruction or something like that, then original Medicare Part A and Part B covers it. So, but what we're talking about, regular dental type stuff, no, it does not. That's where people get either, you know, they get a Medicare Advantage plan. And here's the trick on Medicare Advantage plans. There's a lot of tricks, but here's one of them. If you're looking for a Medicare Advantage plan, you know, which they're, you know, start in October, you're able to switch your Medicare Advantage plan. Let's say next year you have a lot of dental that you need taken care of. So what you do is you say, okay, there's a Medicare Advantage plan that, you know, has this, that, and this other thing, but it kind of sucks on dental. But there's this other one that is not great on some of the stuff, but it's really, really good on dental. So what some people do is they go ahead and get the dental thing, the best dental Medicare Advantage plan they have, because, you know, they need that, and then they have that for the year, and then they get all their dental done, and then they switch back to a plan that covers, you know, more of the stuff that they want. And another trick is if you've got a lot of dental, and let's say your dental benefit in your Medicare Advantage plan is like, you know, $5,000. But the dentist says you need $10,000 of work. What you do is you do at the end of the year, you say, hey doc, let's do the bottom half in November and December. And then in January, when the new Medicare Advantage plan starts and everything restarts, I'll get another $5,000. And then we'll do the top half in January, February. And then dentists do that all the time. So yeah, nice little tricks you can, and remember, these companies aren't giving you this stuff for free. You paid for all of that. All of those decades you paid into Social Security and to FICA and the Medicare part, that's your money. So when they give you dental, whatever, or vision or gym membership or something, you know, these guys aren't being nice. They're just giving you your money back. And don't turn it down. Don't turn it down. This is your money. Go get it. So, all right. I am way out of time again. We're over an hour. I apologize. Got a lot of questions. And if you've got a longer question, make sure you record it and I will answer it tomorrow. But I will be back again tomorrow. I'll come up with another topic for tomorrow, and then I'll talk about that for about 5 or 10 minutes, and then we'll get into your live Q&A and your videos and all that kind of good stuff. So y'all have an awesome night, and please, 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 please take care of each other. Bye-bye.